Hello, everybody. Thank you so much for taking the time to watch this video. My name is Dr. Brooks Ober. I'm actually an emergency medicine physician here at the University of Iowa Hospitals and Clinics, and I'm going to take about 10 minutes or so today to talk with you about what it's like to be a doctor, and specifically about what it's like to be an emergency medicine doctor. So I appreciate you taking the time to watch this video and learn about our field. So who I am, actually just going to move the little video here so you can see a little bit better. I'm an emergency medicine doctor, like I said. I'm an associate professor in the Department of Emergency Medicine here at the University of Iowa. I'm also the medical student clerkship director, and what that means is I'm basically the lead teacher for medical students that are learning in the emergency department with us. I'm also the residency program director, and I'll talk a little bit about residency and what that is here in a couple of minutes. But basically, that's that I am the assistant teacher for student doctors that are actually learning in the emergency department. I've been in Iowa for a very long time. I've actually been here in Iowa City since I was in fourth grade. So I love Iowa City. I love all the people here, and obviously I've stuck around. So it's a great place to live and work and learn. So why be a healthcare provider? What is the big draw of that? And specifically for me, why emergency medicine? Well, first of all, help others. That's something I've loved to do since I was much younger. It's a great chance to help people, and specifically also to work. I love team-based sports. I've always loved sports. And this is a real chance to work with a lot of different people in a lot of different jobs to help make people feel better. And I'll talk a little bit in a couple minutes here about all the different team members that make up that team. I get to meet a lot of people. That's both people that I'm taking care of in terms of patients, but also, again, I get to work with a lot of people that are a part of my team, my healthcare team. And I get a chance to meet a lot of people, get to know them, and I really enjoy that aspect of my job. It's also full of great opportunities to teach. As I mentioned, I'd like to teach medical students and I like to teach student doctors, but I also get a chance to learn from them too. And I think that's one of the big things that is a big draw about medicine for me, is the fact that it's lifelong learning. I'm always learning. I never know everything there is to know about medicine because there's just so much that's changing. And that's something that's really attractive to me about medicine. And lastly, every day is very different. There is nothing routine about the emergency department. Every patient we see comes in with a different complaint in terms of kind of what is making them not feel good. And you never know what that's going to be every day. And I really like that because it's a chance for me, again, to get to know people and really help to try to get them to feel better. So what's the schooling like? You're watching this because you're in school and you're trying to learn more about this particular field. So first of all, you have to complete high school. And then once you complete high school, you go to college, and usually college is about 4 years or so to get your college degree. After that, you go to medical school, and that's between 4 or 5 years, depending on kind of where you go to school. After that, you do something called a residency. So when you graduate medical school, you are a doctor, but after completing medical school, pretty much everybody goes through and does something called a residency. And a residency is basically where you do a lot more advanced training and schooling about what particular field you would like to do. So for me, that was emergency medicine, and that's about 3 years. But there's other fields like surgery or family medicine or dermatology or ophthalmology, different doctors that specialize in different parts of the body or different kind of aspects of medicine. Those have to go through advanced training, and that is what residency is. And after residency, most people go off and then they actually practice medicine. They will practice in whatever field they've done their training in. In my case, and in some people's cases, you actually then also will do a fellowship, which is even more advanced specific training in a particular field of your choice. So as I mentioned earlier, emergency medicine is really a team sport, and that is something I absolutely love about it. There's the physicians, both, again, the faculty like me, but then also the student doctors, the resident doctors. There's physician assistants, nurse practitioners, nurses, nursing assistants, medical assistants, respiratory therapists, physical therapists, patient account representatives. There are so many people that make up the healthcare team, and everybody has to work well together in order to make sure that we are providing the best care to our patients. And I love that because, again, it's a chance to meet these people, to get to know them, and to really work together towards a common goal of trying to make sure that our patients get feeling better. And that's, again, something that I just really love about emergency medicine and medicine in general. A typical day in the emergency department is completely atypical in that there is no such thing as really a typical day. As I mentioned before, every day is different. I get to take care of patients that come into the emergency department no matter what they come in for. So if they come in because they twisted their ankle, or if they come in because their arm is hurting, or maybe their stomach's hurting, or maybe they've been throwing up, I get to take care of all of those people, and I get to try to find out what's wrong and try to fix it, but then also get to help them to feel better. And that's something that I really love about my job. And again, I also get to work with and teach both the resident doctors, which are those doctors, and then also medical students who haven't graduated medical school yet. I get to work with all of them. I get to teach them, and I get to watch them learn and help them to take care of these patients that come to the emergency department. Outside of the emergency department, when we're not actually working clinically, we do some other things. We teach the emergency medicine resident doctors, the learner doctors. We teach them in the classroom, just like you learn in a classroom. But I also get to teach in the medical school and teach medical students in that classroom as well. The other thing that we do is medical students will come and they will actually learn in the emergency department with us. They will help us see patients and they will learn about emergency medicine, and I get to teach them as well. And then also we do some community outreach events where we will do events where we will either go out and provide healthcare in certain areas, or we will do education. It's a real chance to reach out to the community, to get to know everybody in the community, and really help them to get to know us so that we can all work together to make everybody as healthy as we can. So important traits for medicine, if you want to be an emergency medicine doctor, being able to multitask. So being able to do multiple things at once, remembering that you have to do this for this patient and then do this for this other patient, and you have to remember to call back this other doctor who's calling you. Being able to do that and keep it organized and stay organized is very important in emergency medicine. And then also being very responsible and making sure that you're communicating with your patients, you're telling them what's going on, what you found, how you're going to try and make them feel better, and answering their questions. So being really responsible is really important in emergency medicine and with every field of medicine. And then I think one of the most important things too is the ability to put yourself in others' shoes. When patients come into the emergency department, oftentimes for them, they're scared, they're worried because they're not feeling good, and they don't know why that is. And we have to make sure that we are always thinking about our patients and thinking about how they are feeling and be able to put ourselves in their shoes. That's very important for us. My favorite part of my job is the chance to make a difference on the lives of these patients and their families. Like I said, when people come in to see us, oftentimes they're scared, they're not feeling well, they might be worried. Their family members who are with them might be worried as well. And it's a chance for me to help people when they're the most in need. And that's something I really value and love about my job. Another favorite part of my job is actually getting to watch those medical students and those learner doctors, getting to watch them learn and watch them get better over the course of the time that they're learning with us. That is a very rewarding and enjoyable part of my job, because I love to see them grow from, being not experienced and still kind of learning about medicine to actually being able to be full-fledged doctors. That's really a fun part of my job that I get to do every day. So what can you do to get ready for career medicine? And this isn't just emergency medicine, this is any field in medicine. Volunteering is really important. And I think that is something that everybody can do. You can volunteer in a hospital, you can volunteer in various shelters or kind of other areas that need your help. It's a chance to get some contact with healthcare providers if you're working in the healthcare setting, and then also get contact with patients and learn more about being a doctor or being a nurse or being any member of the healthcare team. Similarly, you can shadow and really take some dedicated time to follow along with those doctors or those nurses and learn from them about applied medicine, about their medicine that they work in. And it's a good chance for you to ask questions and learn more about those fields and decide if it's the real. And then another thing that's really important is just studying hard in school. You have to study very hard in high school, in college, in medical school. There's a lot of studying because there's a lot of learning involved. So studying really hard in school now and getting that knowledge is really important. And that's something I would really recommend you work hard to do, is to study very hard in school. What have I learned kind of doing medicine, doing emergency medicine? It's really important to work hard for your goals and dreams. It is a long road to becoming a doctor. It takes a lot of work, but at the same time, it's very much worth it. And if it is a goal, if it's something that you really want to do, if that's been a dream of yours, and again, doctor, physician's assistant, nurse, any field of medicine that you want to work in, it's important to remember that goal because there is a lot of work involved. And if you really, really want to do it, it's something that you can do. And if you mess up, it's okay because you're going to mess up at times. There's going to be hard tests that you have in high school or in college or medical school. And the real key is to learn from that. If you had a bad test, try and figure out why you had a bad test. Or if you're having a bad day when you're taking care of patients, when you're learning how to take care of patients, from those experiences. And that helps you to become a better healthcare provider down the line. Again, teamwork is very important. I've really touched on how important in medicine. Questions. If you're not sure about something, either something in school or if it's something related to a healthcare field that you want to do, feel free to ask those questions because your teachers want to teach you. That's why they became teachers, is they love teaching. So ask those questions and so much more. I've learned so many lessons over the years that have made me the doctor that I am today. And I'm so thankful to have gotten those lessons and those opportunities. The future is very exciting for emergency medicine and for medicine in general. There's new research and technology that's coming out. It's like there's new things. We're getting more access to patients both in the hospital and in the community, which is really amazing for us to be able to provide care to those patients. And then, as we're learning with, this virus around the world, emergency medicine has never been more important. And I'm so thankful to get to work in the field that I do and to get to work with the people that I do because emergency medicine is very important and it's a good chance to take care of these patients. If you have any questions, you can have your mom or dad feel free to email me. I'm always happy to answer questions. And thank you so much for taking the time to listen to me today talk about emergency medicine. I hope you've gained some knowledge about the emergency department and what it takes to be a doctor. And I hope that it's something that you choose to pursue further, either through shadowing, through volunteering, but just gaining a little bit more knowledge about it. And again, I'm always happy to answer questions if you want to have your mom or dad email me. Thank you.